I've been studying, reading, writing, and teaching about drugs for over 30 years. And I do that because they're fascinating. These tiny little chemicals can kill us or cure us. They can change our bodies and our minds and change society. People in every society throughout human existence have used drugs. And people use drugs for many reasons: to find pleasure, to avoid feeling pain, to feel physically and emotionally stronger. They may use drugs to feel more or to feel less. They may use them to attain a sense of connection with others, with nature, with God and the universe. People use drugs to fit in and to stand out. And our attitudes about drugs change based on many factors. We feel differently about the same chemical depending on who is using it, why they're using it, how old they are, even how it got into their bodies. And often the legality of drugs depends on arbitrary and often non-scientific ideas about drugs. So these attitudes have a real world and significant impact on our lives. Now, over the course of our journey throughout this book, we'll talk about so many juicy issues. We'll talk about many drugs, recreational drugs, both legal and illegal, medications, both prescription and over-the-counter. We'll talk about drugs that people take because they want to feel normal, and drugs that people take because they want to feel not normal. And for all of these drugs, we'll talk about their history and laws that govern them, how they work in the body and their effects, both good and bad. We'll talk about their economic impact and their social impact. And as we talk about these drugs, remember that there's no such thing as a good drug or a bad drug. What matters is the relationship a person has with that drug and how it affects their mind, their body, and society.